Today, I'm really excited not only about having you here, Jeff, but about the topic that we are discussing, which is about patient acquisition and all the ways it has been impacted by COVID. So first of all, let me introduce you to Jeff Atwood. Jeff is our newest expert in residence. How do you like that title?
That's very, very fancy. My children are very impressed.
They have to call you that now at home, right?
Yeah, well, it's Mr.
Right, as they should.
That's right.
Jeff has so much experience in the healthcare industry, and so you are spending time with us this year and our team, and not only helping us create content, but helping us work with our healthcare clients and really look at all the services we offer when it comes to the healthcare industry.
Well, I think it makes so much sense, Shannon, right? Because Nashville is the hub of so many things
Right.
healthcare. You guys have done so much work related to change makers, people that are making a difference
Right.
in the worlds they serve. So I think the intersection of the work that 5x5 has done in the Nashville community makes a lot of sense.
Yeah, we love the healthcare industry. I've told you the story early on when we started 5x5. A friend of mine who is a CFO at one of the largest healthcare organizations in the city came to me and said, I just saw the organization you launched. You're going to work in healthcare, right? Because we are change makers. And we know that healthcare workers are change makers.
And your response was
yes.
well, of course I'm going to do that, right?
That's right. It's been such a fun journey as we've taken on more and more healthcare work, and we're thrilled to have you with us
Well,
this
I'm glad
year.
to be here.
Yeah.
Glad to be here.
So this is an interesting time in the healthcare space.
It is.
I know we have and should have and will continue to talk a lot about the way those who work in healthcare industry were impacted,
Right.
from frontline nurses, doctors, all the way to those that support them. It has been a tremendously challenging year.
Absolutely.
I'm sure we don't even know what's to come, all of the fallout.
I think that's going to
there
be
will
the thing.
continue to be.
Yeah, as we go forward, we're going to uncover. Well, there's a problem that was created by
Right.
here, by this, by that. And it's going to be one of those things. It's not going to be weeks or months to understand and uncover, but really years probably.
Yeah, absolutely. And so we want to keep that conversation going. That's going to be a really important one
Sure.
in the healthcare space. But at the same time, there is another population that we need to discuss, and that's our patients and the
Absolutely.
impact that they've had. So as we look now going kind of post-COVID, I think we can
Right.
finally start to see that and say that,
I can
right?
see it from here.
So when we talk about that, what is the impact on patient population?
Well, I think what happened was is you go back a year, really almost a year exactly from where we sit right now, and if it was like a record, that sound record, and that's what happened to the healthcare system.
Right.
Literally, the first part of March of last year, everything just almost stopped. 100% people go, all right, what do we do? What can we do? And so you sort of see that most clearly, really, probably in surgery. Because if you look at a graph of surgery volumes, or early part of the year, good, and then the bottom fell out, and so hospitals and healthcare systems found themselves down about 40% early on in the pandemic, and then it sort of climbed back. But even in the last 2 or 3 or 4 months of the year, surgery volumes were down at least 10%.
So practically speaking, what does that mean for the healthcare
Well,
industry?
practically what that means is this is going to take a long time to kind of resolve itself, because what happened is, if you look at these trade journals, like the Orthopedic Trade Journal, they say they've got a backlog probably into 2022 of 1 million or 1.5 million just nerve and back and spine cases, or like the Journal of Cataract Surgery. What they say is probably similar, anywhere from 1 to 1.5 million cases that have been held back, and it'll take at least until next year. And that's, I think, pretty optimistic.
Yeah.
And then even, so you were talking about earlier, the longer tail on some of these things is the fact that you've got these cases that went undiagnosed for a period of time.
Right.
Lots of cardiac problems,
Right.
ENT problems. I think the one that's the most concerning to people is cancer, especially pediatric cancer. Parents were afraid to take their kids to the doctor.
Yeah.
And so what's going to happen is over the next 5 or 6 or 7 months, some of these things will begin to unfold. And we'll have to sort of understand kind of what does this mean. And I think the challenges are twofold, right?
Okay.
The challenges are twofold coming out of this. One is organizations have to begin to rebuild safety. Patients have to know that they are safe to come back to the organizations.
Yeah.
And then secondly, these healthcare organizations have to go, how are we going to take care of all these patients?
Right. Okay, so here at 5x5, we focus on the marketing and communications
Right.
aspect of the healthcare industry. And so
Right.
that first one sounds like something
That's right.
that
That's right.
as marketing professionals, we can have an impact on the perception and the feelings of safety.
Right.
And that's something we need to step into,
Absolutely,
right?
I think so. I think so because if you look at it just from a common sense, you as a parent, me as a parent, you sit back and go, all right, I saw all of that stuff on television, right? I saw the horrible things play out all across the country, and you see the impact on the nursing staff and the physicians and the housekeepers and the dietary staff and everybody, and just how they were all crushed over a period of time. And you saw the tragedy there. Well, that doesn't go away overnight just because you wake up in July of 2021 and go, you know what? My knee still hurts. It needs to be scoped or whatever the case may be. So hospitals and healthcare workers need to do a lot of work to try to rebuild that confidence. And I think, and McKinsey talked about this in some of their consumer insight reports, they have to be very proactive on this. You just can't wait and go, oh, we're over here, we're a hospital or we're a practice and we're fine. You have to be proactive about it.
So we need to build a strategy around that.
Correct.
We need to be intentional. We need a strategy for what does that look like for our organization and our messaging going forward.
Absolutely. And you do it in just the traditional ways, right? But instead of saying, all right, to the population, you weren't able to get your surgery done or you were nervous to come to the hospital, just come on back and we'll be fine.
Yeah.
The reality is that's not going to happen. Hospitals, to take care of the backlog that we have right now, you'd have to even into next year, you'd have to increase it 20% in terms of volume to catch up by the middle of next year. That's not going to happen for all the reasons we know, right? Because they're still busy and the staffing issues are the same. So what we need to do as the healthcare community is we need to go to folks and say, you know what, more than anything else, we're safe. We're staffed. We have the ability to take care of you. And if they can do that proactively, then what can happen is they have to have that basis of trust, right? Because if you don't have that basis of trust, you're not likely to come back to that organization. Once you have that trust established, then you can go back to them and say, you can come back and have your surgery.
And so the second one you said was actively contact them.
Actively.
So that's again, we're saying be proactive in your messaging, control that messaging. You got to be. We know in order to communicate something, you've got to be consistent and you have to over communicate.
Right, and it's a push, very much a push.
And now we got to push it out. What does that look like?
Well, I mean, it just looks like all the things you would typically do. You would do digital, you would do social, you would do YouTube, you would do blogs, you would do all this content that you would aggregate so that you're consistently pushing it out to your audiences to let them know. Because again, we have a year of all this concern about the healthcare system, right? That doesn't just change because, well, we got a vaccine, we're all better now. We're going to need a period of time where we're going to actively need to push the information out about that we're safe and it's a secure place. And you can come in here and know that the hospital is going to have the resources and the staff and the tools to take care of you.
And contacting those patients and saying, when can you come in, right?
Exactly.
That active contact, it's amazing. I mean, I think of all the appointments on my mind, True Confessions, right, that I've got to go get done. But if somebody could get me on the phone, first of all, I know it's time, but if we could do that, I'm ready to schedule. I just don't have it number one on my priority list.
You've got to remind people that, oh, that's right. My knee still bothers me. Or there's lots of ENT surgeries that were pushed off, or even plastic surgery cases that were pushed off. So the reality is you have to remind them that it's safe. You have to let them know that it's safe. And then secondly, you know what? It's okay to come in and do this now. We're here for you.
So I think if we come down to one word, maybe let's boil down to proactivity,
Exactly.
right? We have to be proactive on all of these things. These things won't just happen naturally. We're busy. We got all the regular parts of our job.
We're not going to wander back to hospital websites and go, can you do this now?
That's right.
The organizations, the practices, the surgery centers, the hospitals, they have to be proactive.
Maybe more than ever.
I think absolutely more than ever.
Yeah. So thanks, Jeff. We really appreciate this. And, we're excited to work with healthcare organizations. And one of the things I think that we're really good at here is the strategic part and putting together that intentional plan that then we can figure out how do we execute that and really find great results from that.
Absolutely.
And so thrilled to have you working with our team.
Glad to be here.
Let's do another one of these.
Absolutely. Look forward to it.
All right. Thank you.
Thank you.